Welcome back to the Faculty Factory podcast, everyone. Kim Skorupski here. And with me today is Dr. Dulce Cruz. Dr. Cruz, how are you?
I'm doing well, Kim. Thank you for having me. How are you?
I am great. I'm really excited to learn about your project today and share with the world this very interesting topic that to date we have never covered on the Faculty Factory podcast. But friends out in podcast land, let me tell you about Dr. Dulce Cruz. She is at Johns Hopkins University in the hospital. She is an assistant professor in the Department of Medicine, the Division of General Internal Medicine, and the section of palliative medicine. And I learned about Dr. Cruz from a mutual friend, Dr. Marcella Blinka. Marcella and I were at lunch one day, and my background is in gerontology, and she's also she's a social work PhD in social work, and was talking about her work and her qualitative research. And she mentioned Dr. Cruz's work and having created these videos, family hospice videos. And I had no idea about this, really hadn't ever heard about anything like this. And I thought it would be interesting to hear from Dr. Cruz the journey of how she identified a need for this, what she does, and how this project went from idea, conception to, you've been doing this, I think, since you said 2012 or 14, so only 10 years
Correct.
or more. So thank you again, Dulce, for being here. And please, just kind of take us back to, gosh, maybe around 2010, before you even maybe had the idea. Or I'm curious when it arrived to you that, wait a minute, here's an unmet need. I know what we should do. So take it away.
Yes. No, thank you. Thank you for having me and for that for the invitation. So everything started. So I'm a geriatrician by training, and also a grandfather in palliative care. So that's to give you a background, because as a geriatrician, I started working in St. Louis University back in 2010. And I got a GACA, which is a grant through HRSA. It's a geriatric academic career award. And in this project, my title was Improving End of Life for Elderly, Latino Elders. So when I started that work, I went on, did a needs assessment. What is needed among Latino elders at end of life? And I was curious to see that family caregivers had a big need. There were studies done on them, but they still were big need. And mix that with my geriatric experience in seeing many families going through a lot of struggles as they care for their loved ones, and also my personal experience, because I did see I was fortunate to have a grandma that was old enough, 103-year-old, and I saw her being cared for by my aunt, and she was fabulous, but she had trouble receiving help at home. My aunt had trouble accepting help at home, and that got me thinking, how can we help people and better care of their loved one at home? So mixing all those experiences, the professional one through that needs assessment, which I did with focus groups and literature review, and mixing that with my personal experience, one of the things that the focus group one of the conclusions of this focus group was, why don't you do videos? And if it's for Latinos, let's do a telenovela. Oh. And I'm like, great. And then it so happened that I was in a great place, St. Louis University. Also, the Greg that existed back then was very good at doing a lot of community education, and they had a kind of like a way, some people already with experience in creating videos. And they connected me as well with a colleague of mine in San Antonio, Texas, Sandra Sanchez Riley. And she and I collaborated in this project. That was my first telenovela. It's called Cuidadores Como Yo in Spanish. In English, is Caregivers Like Me. and that's available on YouTube, so you can find it. And even though I don't think it's my best, but it's my first one, and it was fun. It was fun to create, and it was much more fun to show it to people, show it to family caregivers. I went ahead with the collaboration of Sandra. We showed this video to around 145 family caregivers between Missouri, Texas, and Puerto Rico. Yeah, Missouri, Texas, and Puerto Rico. And we showed this to them. I just did a simple pre and post test, and we in the pre and post test that we did, we asked them if they were more willing to get certain services, because part of the of our intervention, let's call it, back then was not intervention, we showed the video and then we combined that with talking to them about the resources for family caregivers. And we asked them if they were willing to use these services. And it was statistically significant, the change before and after. They were more willing to use, for example, a shore worker or an aide. They were more willing to probably access a social worker or to use assisted living facility and things like that. So then, so that was very interesting. And also when you ask them, what did you learn and what do you want to learn and what did you learn? What they learned, what they wanted to learn, they wanted to know how to take care of the loved one. And what they say they learn is they learn where to find help, where to accept help. That is important to accept help. So my conclusion from that is that because the way they learn, what they got out of this video was they wanted first to learn how to help their loved one, and they got that by what they learned was that they need to ask for help and accept help. Wow. So that was the first time doing this type of work.
Wow, Dr. Cruz, thank you, first of all, for doing the work and mostly for sharing this with us. And I think it's so important, and I'm thinking of so many comparisons or ways that we can grow and learn from your experience. And if you don't mind, I'd like to take you back to the focus group, because here in my arrogance, I'm thinking that this idea was your idea. And I think I heard you say that you're doing the focus group, and the focus group participants said, why don't you do telenovela? Is this true that it was their idea to, hey, why don't you do some video?
Yeah, it was kind of like, why don't you do a video? And it has to do a video in their own language. Mm-hmm. And it has to do a video, not translated, not with double. It was done in their own language. And that talks about caring for their loved one, basically. Wow. Yeah. And then between me and Sandra, we came up with, let's just do a telenovela. Instead of calling it a video, let's do a telenovela.
Well, what I think is important about this, and I think it's so awesome, is the humility, if you will, in saying that we as scientists and physicians and healthcare professionals and educators, we obviously have training and expertise and tons of ideas every day. And then that recognition that you go into public or any other in the community and recognizing that there's wisdom in this group right here. And you probably could have come up with, 12 other ideas, and to hear and to give the space to them in the community to say, I'm a caregiver, geez, what's palatable to us? What do we know? What's comfortable to us? The idea of a video, because you could have said, well, you can write a paper. We could do a pamphlet. We could do seminars. We could do workshops. We could do a poster presentation. I mean, you could have done 100 other things that would come from our scientific kind of background. And yet, the simplicity and the elegance, again, and back to the humility of recognizing, you tell me, what do you think would be the best vehicle? And then they gave you that idea, and then you ran with it. And so I think that lesson to me is another reminder nothing about us without us. So the focus group is clearly a good mechanism to collect data and do research. And it's also the utility is literally hearing the people who are in it, not studying it, but doing it from their perspective. I mean, if it obviously we want to help them, so why not tell them what they need versus us saying, what I think they need is, or what they don't know they need it, but this is what they need. So kudos to you, first of all. I think that's brilliant. And then could you tell us a little bit about how the video itself, the novella, evolved? So for people who don't know what is telenovela, this is clearly was not, I'm guessing it is not, because I've not, honestly looked at the video. Or videos. It's not you in a PowerPoint presentation. So can you tell us a little bit about the content in general with your video series?
Sure. Let me first define what is a telenovela and say what's the difference between a telenovela and a soap opera, because they are different. So a telenovela is a dramatic story. It has a beginning and an end. Usually soap operas do not have an end. And the dramatic story is very dramatic, but it also is a way to convey a message. It's a way to convey some form of education. That's the way we are using it. So it's a television show, curiously, that is very popular in Latin America. But when let's say, I don't know if you heard of, there was a recent telenovela, right now I'm blanking out on the name, but I'll find it later. It's when they did a poll, a lot of people, even non-Latinos, watched it. So they found it to be very engaging. The whole point of using that form of video as education is because it's engaging. And it's very easy to use role modeling in it. So anyway, let me tell you more about the content. What is that? It's just, basically, as you were saying, we go to the community and ask them. And after this telenovela that I'm telling you, the one that is available in YouTube, it has a component. The telenovela is inserted inside of a video recorder PowerPoint. However, the other two is are videos, completely videos. I decided to get rid of the video recorder PowerPoint completely. I wanted to use just a story. But what we did with the other two, and I would like to describe the process of the last one, so that you can use that as how it got developed. The last telenovela, what we did is we wanted to focus on Puerto Ricans and on African Americans, and we wanted to help them better manage symptoms. So we went back to them, we interviewed a small group of them and asked them about what their feelings with shortness of breath, with nausea, or all those things. So from those interviews, we kind of did a qualitative analysis of them and developed themes. But mainly, I am the one that have come up with the scripts. So, and I create these scripts using my own personal experience with patients, but I mixed that with the information I got from the interviews. So I created this story of family caregivers, and then I did a script first. And I did that with my research team. So I created the first script. My research team sees the first script. We tweak it back and forth. This doesn't sound good. This is not real. This doesn't sound like clinically accurate. Let's change it to this. Things like that. Or this doesn't go with the community. I think we should say it this way. Then a second script comes to be. And then that second script, we take it back and we show it in a focus group to the community for their feedback. And it's kind of like, imagine you and I reading the script, but you are one voice, I'm another voice. And then we read the script so that whoever is in the focus group can understand what's going on. And then we hear feedback from them. And then based on that feedback, we kind of tweak and created a third script. And this is kind of like almost the final script. And that's the one that goes into production with a film company.
Oh my
so
God.
that's the process.
It sounds like Hollywood, where they do the table read and they're with a live audience and see where the laughs come and where the emotions, and you've got the producer. That is really, you taught yourself that whole process, or were you just organically understood how you'd have to make these iterative versions? How did you know how to do this?
I took a course online.
You did on video production, or how to do a telenovela, or how to write?
No, just a video production. That's it. That's all.
Oh my gosh!
It was just it was kind of like a very fast course, and with those bases, with that course, I learned how to write a script. But yeah, that was it. I didn't do. I'm not a filmmaker. I'm a doctor, and I use my own experience. And there are some stories with patients that stay with me, and I find that they are very, very, very interesting and very educative. So I can, of course, and I also put my own personal experience with friends and families. But in any case, that's where the creation came to be. And after we film it, then we did show it to a group of family caregivers to get a little bit of feedback. Of course, I wish I had all the money in the world to go back and film other parts of it. But basically, you can cut and you can do some changes in the way things are said here or there and what parts to show or not. But basically, that's kind of like a summary of it. And then the biggest question I have now is, how can I make this available to the people that I need it and that they will use it? Because I already have tested it in 2 ways, and yeah, it's not being used, like as part of an online support group, Facebook online support group. People, and granted, I have to do a parenthesis because I forgot to mention this. The population I ended up narrowing down was hospice family caregivers. I forgot to tell you that. So the last 2 telenovelas that I said that I followed this process that I just described to you are 2 telenovelas focused on educating hospice family caregivers. Why? Because I saw a big need in them, especially at the beginning and all them. Many people tell me, what about the bereavement group? Yeah, they're important, but also this group is very stressed. So what I am doing now is trying to show the telenovela to one of those telenovelas to a group of African American and Latinos hospice family caregivers, and trying to test if it does change anxiety, self-efficacy, and other measurements. But I want to know if at all, bottom line, if it makes their hospice experience better, if their satisfaction with hospice is better. Mm-hmm. That's what I want. I want to help this experience to be better, even though it's horrible in one way because they're losing a loved one. You cannot make that better, but at least you can soften that in one way or another, at least attempt. That's all.
Yes. And you have it. This looks like a real a movie scene. I mean, I'm looking at it now. And where did you find the actress or actresses in these telenovelas?
Yeah. By the way, I found the name of the telenovela I told you, Jane the Virgin.
One? Jane the Virgin.
Yeah, that's a telenovela. Was very famous. It was very well viewed recently by non-Latinos, both Latinos and non-Latinos. Jane the Virgin.
Now you're saying this does sound familiar. I have to look that up. I think the medium is just fascinating. So back to the actors and actresses. How do you find them? Are they family members that you have to twist their arm?
No. You will be surprised. That's another interesting thing. And by the way, you said it was like Hollywood. I mean, it is, to film it is very, very hard. I never thought ever having that type of experience, but it's really intense. Going back to the actors. So the first one that is available, they are bilingual actors, of course. We filmed this in both in English and Spanish, which was very hard on the actors because they had to learn two scripts in two different languages. But we did it. We were able to do it. And this, I was fortunate to do that first video in collaboration with my colleague in UT Texas, San Antonio, and that was very easy to find actors there bilingual. The other ones, it was not so easy to find bilinguals. I did that. I collaborated with a filmmaker, Maestro in Philadelphia. It was the first time they did find good bilingual, and then afterwards it has been harder to find bilingual people. But it was very interesting because one of the actors, so they always, many of them have had a caregiving experience. One of them was a social, officially, he was an actor in one of my telenovelas, but his profession is a social worker. Okay. So it was wonderful to have him do this role in the telenovela.
So natural.
Yeah, very natural.
Wow. Well, the whole idea of you, it's so creative. And this is what has inspired me ever since I first heard about this, is it takes me back years ago, and in my now new professional space of faculty affairs and faculty development to the Association of American Medical Colleges. Years ago, there was a group of actors from Washington, D.C., I think, and they came and did a skit on the promotion process and had a table set up in the middle of the room and had reviewers sitting around the table, pretending and acting a scene like they were going to get someone promoted or hire someone. And everyone, the 200 of us in the audience, were sitting below the stage because the stage is in the middle of the banquet hall. And so we were witnesses to the conversations and what they were talking about, what they were saying. And then there was a debrief. They did the skit for like however many minutes and then opened it up to Q&A. And I remember being so kind of intrigued by bringing in the arts, if you will, into this space of us being these academics and seeing something acted out as a tool for learning. Now, clearly, all the educators out there are going, well, yeah, we know that. We obviously know that. But it was a novel way for me to think about how we can heighten awareness, not only as scientists and educators and caregivers and physicians, but thinking of not only for self-knowledge, but how we can then use that tool itself in our own work. So it's a kind of bi-purpose, right? That I'm a new way of me to learn stuff, but then a new way, a methodology for me to teach things. So that's what I think is so cool about this, that I see so many applications in other venues that maybe we can revisit the methodology and the technique, which I think is brilliant. So I'll stop there and kind of give you some room to think about that, because then I would love to pivot into what you've learned from it and how you've moved the needle on raising awareness. And it sounds like a lot of culture change, and talk about affordability, accessibility, and availability. But sometimes a lot of that stuff depends on, as you've demonstrated, cultures being able to feel like it's normalized and removing stigma around caregiving, and that I'm not being a good daughter if I'm not doing it myself. So it's kind of separate conversation, but kind of backwards a little bit. The methodology, the tool, what have you learned from that whole process?
Yes. One of the things that I want to comment before answering that question is adult learning. So that's another thing that I got a little bit of training on adult learning as an academic. They offer you that. And that has been very interesting. That was a very interesting thing to learn about, like how does an adult learn something new? It's different than a student when they are already formed and have their mind on things. And that's why the telenovela is a great tool, because you can use a lot of those adult learning strategies. What have I learned in this process? That's a very good question. I have learned a lot, especially in terms of how to do research and how to make this available to people. Is so important. more and more, many people tell me this is an important work. This is something that is needed. When can we make this available? When will that video be available? And yeah, that's a big question I have. And then, but as a professional, I have learned that I have gone through a lot of hurdles, especially when in terms of funding, and but thinking, we do this because people have needs and caregivers need more attention, more time. Therefore, I need to keep going. And I also learned that, for example, the caregivers, the first time I tested this, caregivers that watched at least, so these videos usually, so it's like a telenovela. In the old times, nowadays it's different, right? But in the old times, when television was television and it was this way, every week I grew up watching telenovelas myself.
But like you said, the soap operas, my grandma called them my stories. Be quiet now, kids. Grandma's stories are on, my stories. And they were just, yeah, it was soap operas.
So before you used to watch a chapter a week. You had to wait a week for the next chapter. And you were talking about it all week long. Did you saw what so-and-so did? And can you believe this? And you're waiting to see. It's like the series now, right? But anyway, but now, so we were delivering this weekly basis. And we noticed that they were watching many people, because these are hospice caregivers. Many of the patients were dying too soon, and then the caregiver was not able to watch all 4 videos because you need like 4 weeks. But what we learned from that first study was that they need to see at least 2 videos, 2 chapters, to see a benefit. We saw a tendency to decrease anxiety and to increase self-efficacy in those people that watch 3 or 4 videos compared to less than 2. So that's one thing I learned, that we need to make it available.
Yeah, I totally agree that it sounds like we don't have the luxury in this hospice space to say, tune in next week, because families are like, can I watch all these more expeditiously, and options to see them in a bundle together.
Yeah, the other thing we have learned is not everybody benefits from it, of course. Not every hospice caregiver is in the same wavelength, let's put it that way. There are some caregivers that I did have a couple of people being turned off by the dramaticity of it.
Oh.
I did have a couple of people commenting on that we captured that in interviews. And we also had a group of people that loved it, that even cried after the videos because it was so much into what they were living. And those were the stories that really stay with me. Those ones that really, at the beginning, those first 10 or 8 people that watched that last video, which is the final journey, I think one of the most beautiful ones that we have, the most beautiful chapters that we have. It's really, it was really interesting to see what they learned from it and how moved they were.
Yeah, I think this is so important, this work you're doing. And I love that you presented the content, the knowledge, the information in a way that resonates with a lot of people. You admitted not everybody liked the dramaticity of it, maybe thought it was too, as my sister would say, you're being so dramatical. But some people really said, yeah, that's my life. And even if something is kind of very dramatic, there are elements in there that we could probably say, yeah, I get where this is coming from. And anybody who has loved anyone or has any kind of family, we have all experienced this. And if you haven't, you're going to. So I think that's what's, so important about us being creative and innovative and being willing to learn new things. As you said, you took a class. you hunkered down and I got to teach myself how to do this how to one do video production. So being willing to go outside of our comfort zones, be open to inviting others to help us, true interdisciplinary. Oh my gosh, the community and people in acting and video production and editing and all those kind of technicalities, that's truly being innovative and interdisciplinary. And again, I can't help but think about my colleague, Dr. Martin Feeder, who used to be a dean at University of Chicago, and he's retired, living the glorious life in Colorado now. I mean, Arizona. And he and I, when we were hiking around, he said, "Gosh, there are all these shows on TV all the time of Chicago MD and ER and all these police shows and all these very dramatic series week after week after week that are on TV that depict scenes in hospitals and fire rescue and police shows. And yet, why don't we do others? Why aren't there other series that go into other topical areas that are important in the life of people in academia? So not only humorous of like how to get promoted and the foibles and eccentric personalities, but like real ones that could be like, why don't we have more series that talk about caregiving and end of life and intergenerational families and the struggles of balancing an academic career and trying to have a family and how the continuum of the life cycle of being an early career assistant professor, associate professor, and all those struggles and challenges. And then he looked at me, we looked at each other, we're like, maybe there's only so many 100,000 people in the country, maybe the world who would be interested in that. But I think there's so much there that makes me think someday maybe somebody will get a huge grant and will do some kind of a series or a Netflix series that'll be for like academic scientists, about the discovery and the patient and kind of cover all those elements. I think that would be enticing. So anybody listening to this, give a lot of money to Dulce, and to other creative geniuses out there who have that artistic itch in them to create something that would help communicate important messages, but can be used as a vehicle to train, so people watching you go, oh, I had no idea. That's a really good point about that end of life. And oh my gosh, it is right. We shouldn't feel so guilty. And mom wouldn't want me to have to quit my job to stay home and take care of her. And yeah, I love him so much, but he's driving me crazy. How can I love him and feel like I hate him at the same time? I mean, all those emotions, now I'm walking both lines of talking about, the caregiving and hospice and faculty affairs, faculty development. So I'll shut up here, but I love the work you're doing.
One other thing that we learned is how we can deliver this. This is still, what is the best way to make this available? We came up with one idea and we are testing it now.
What's that?
The first two ideas were, as I said, an online support group. People said they didn't have time to watch it. And the second idea was putting it on an iPad and giving it to caregivers to see, and with a plethora of videos so that they can watch on their leisure time. Not that many people watched it. So the idea that we came up with was do a Zoom meeting with an interventionist. So introduce the video, share the video, and then discuss it. We did this, and this idea basically came also from hospice staff, that they said the nurse should watch, the hospice nurse should watch it with them, or the social work staff should watch it with them. Problem is, these are very busy people. And that is focusing mainly on patient, which is their job. It's their job, but their job is also supporting the caregivers. So this is a tool that can be added on for them. And I still have to figure that out, how we can incorporate that into the hospice service line. However, this delivery using Zoom, using remote way, and kind of like a checkpoint. Like I have a date. There's a 15-minute meeting with someone, and it's a 15 minutes for me. And that's kind of like my time. And they really appreciate that. Many of them like that. And they like the fact that it was remote as well, because it makes it easy.
Yeah.
Of course, that leaves out people that don't have internet access. That's kind of like a big question mark there. But we are just in the start. So that's another thing that we learned.
Yeah, Dr. Cruz, I mean, you're really getting my brain to think about just the hospital side of the work we do in academic health, and that is the patient experience. So, you're talking about how do we do what we know is important and valuable, not only for the patient experience, but the patient caregiver's experience. And if we're doing things right, the patient's family members and loved ones will be future patients. So building that whole experience around a hospital making a decision to invest in the family system beyond the
Right.
patient, I think it's a budgetary, it's a philosophical, ethical, financial decision, because as you rightly mentioned, the nurses and social workers are like everybody else, they're underwater. So how do you make that happen? We have to have the service line there, we have to have the people there, we have to have the funding, and we have to have people who want to get into this line of work. So it kind of opens up a whole way of thinking about how we provide care and to what end. So I just think that you've raised so many interesting care experience, financial, ethical, moral questions, as well as educational ones in terms of the modality. I just think it's such a fascinating area. And it's certainly not going away. It's not as if, well, once we solve this disease of aging, we don't need this anymore. This is not going anywhere. Caregivers are not going anywhere. And guess what? Caregivers are human beings at this point, and human beings mostly have to work. So we need to figure out how to have policies, programs, and resources, and start talking about it. And like I, as a gerontologist, talking about later career programming and planning for retirement, and what is my identity, my purpose, my meaning after being a surgeon and being a doctor my whole life. Who am I if I'm not working? And so preparing for these stages in later life, we don't do that. So I think normalizing, standardizing, talking, destigmatizing, and thinking more globally about the patient experience and expanding that vision of who is the patient and what does that mean is probably going to be one of our big next steps. The guide model is a good start. Tell me about the guide model. You just chatted me. I love it. I love this is the most polite way of a podcast guest saying, if you stop talking for a minute, Kim, I got something else to say. Dulce just chatted me. Tell us about the guide model.
No, the guide model. No, it's just something just got approved this past, if I'm not mistaken, April. It started in June or July of this year. It's an interdisciplinary program funded by Medicare. There have been, I don't know, I think more than 200 centers approved by Medicare to provide support and education to caregivers. Everything is in the start, so I don't have that many pointers about it. We are fortunate that Hopkins at Bayview is one of those centers, and I'm looking forward to see what this will come to be, because it's just I know of other places in Baltimore that have it, and other states. It's just that it's a way to provide family caregivers more support. That's the gist of it.
I think the CMS, the guiding and improved dementia experience guide model. Is this it?
Yes.
CMS. Okay. Guide, cms.gov, guiding and improved dementia experience guide model. I did not know about this.
Yes.
Wow.
Especially because dementia is one of the conditions that is in the rise right now, and caregivers need a lot of help with that disease. And this is one way that CMS has. Of course, there's a lot of evidence out there that if you provide support, then the dementia patient has a better quality of life, less institutionalizations, and less hospitalizations and things like that. So you do you can do good with these type of programs. And it's just in the test right now.
Right. It says testing an alternative payment methodology for participants who deliver comprehensive coordinated dementia care. Under the model, participants will assign people with dementia and their caregivers to a care navigator who will help them access guide services and supports. Fascinating. Oh, thank you, Dulce. Well, I love your work. So what's the next step other than us all concerned around the world? Let's all try to find a funding mechanism for Dr. Dulce Cruz. What else, in addition to resources and funding, what else is the next step for you? What are you excited about in this journey?
Right now, I'm excited to test it. I will start in a couple of weeks, next month, hopefully. I just got IRB approval, and I have a couple of hospices very, very, very excited to collaborate with me. And that's my next step right now, just testing it. And yeah, and then the other step is figuring out the questions I raised, how to make this available to the people that need it. And then really testing if not only if it is effective in terms of how the anxiety self-efficacy is affected, but also see if what are the active components. It's so important to figure that out so that we can tweak it to a more scalable form. So those are my next step right now, in terms of figuring out and continuing this work and not giving up. That's that's my third very important step.
Good. Never give up, never surrender. I think that's from Galaxy Quest, a great movie. But yes, Dr. Cruz, you were a wonderful guest. Thank you so much for sharing this valuable resource. Folks, get on YouTube, just type in Caregivers Like Me. You'll see it, and you'll see the portfolio of other videos, and you can reach Dr. Cruz at her email address, which is dcruzoli@jhmi.edu. We're going to put her, of course, as always, her profile, the description, and her email, and we'll link to the YouTube videos in the description on the facultyfactory.org website. But any last I'll leave you some parting thoughts, Dulce, and again, thank you so much. You could say whatever you like. It's all up to you.
Always, when caring for patients, keep in mind the family caregiver. Listen to them, pay attention to them, and help them. They need a lot. They need a lot of help. So please listen and keep in mind the family caregiver and help them.
Hi, Faculty Factory podcast listeners. I'm Kim Skorupski. I want to share a great opportunity with you. We've created a faculty leadership collaborative of faculty affairs and faculty development leaders from around the country, and we're offering a leadership boot camp in January. This one is for early career faculty members. That is, faculty members at the instructor or assistant professor rank for about less than 5 years. The boot camp will be 3 hours a day for 3 consecutive days. So specifically, it'll be January 14th to 16th. That's a Tuesday, Wednesday, Thursday, from 2 to 5 p.m. Central Standard Time via Zoom. And the registration fee is only $299. The boot camp provides overviews of key leadership competency areas developed and delivered by faculty members in academic health for early career faculty members in academic health. So with 9 contact hours, you'll learn about leadership principles that apply to yourself, in relation with others, and in complex organizations like ours. So this opportunity is open to early career faculty members in academic health institutions around the world. So please share with your friends. Let me tell you what the topics include. Overview of leadership competencies, self-knowledge and finding your voice, communicating for influence, difficult conversations and conflict management, organizational savvy, negotiating resources for yourself, promotion and career development, developing healthy academic habits, mentorship. This is on being a good mentee as well as being an effective mentor, resilience and work-life integration. And we also have a panel presentation that closes off the 3-day session of 3 recently promoted associate professors in different pathways in different institutions. So you'll get to hear from them about lessons learned and hints they'd have for you to how to grow your career and get promoted. So again, it's 3 days, January 14 to 16, 2 to 5 Central Standard Time. It's only $299. To register, go to the facultyfactory.org website. It'll be on this podcast description as well as on the website. And I want to also run through the names of who our presenters are this year. Dr. Karma Fouché from the University of Illinois in Chicago, Dr. Rachel Levine, Johns Hopkins School of Medicine, Dr. Hannah Lundberg at Rush University Medical Center, Dr. Susan Matulavicius from the University of Texas Southwestern Medical Center, Dr. Elza Milona from Methodist University Cape Fear Valley Health School of Medicine, Dr. Bob Tillman at Baylor College of Medicine, and Dr. Valerie Williams from the University of Oklahoma. So we have a broad panel of experts. My colleagues and I, Dr. Susan Chubinskaya and Nutan Vaidya, are so happy to bring this faculty leadership collaborative. We're all going to be working together around the country to provide more boot camps, small, condensed, efficient Zoom platform to do some high-level overviews. We'll be doing a mid-career in April. So we hope you sign up and share this opportunity with your friends. Talk to you later. Thanks, everybody.
Thanks for tuning in to Faculty Factory Podcast. The mission of the Faculty Factory is to build and support a community of leaders in faculty development who share tools, resources, wisdom, and encouragement in service to our faculty members, schools, and institutions. We encourage you to go to facultyfactory.org to find out more. Get in touch with me, ask me any questions. Maybe you want to be interviewed on the podcast. Thanks for tuning in to Faculty Factory Podcast. We'll see you next time. The Faculty Factory podcast and website is sponsored by the Johns Hopkins University School of Medicine Office of Faculty. For more information, visit facultyfactory.org.